And Justice of course, Land 2 Senator Therese Terlaje jumping onto the show. Good morning, Senator.
Good morning, Sabrina and Chris. Good morning, everyone.
Yeah, pretty eventful show. Welcome to the program.
Yes, thanks. Again, you guys are doing great. Getting a lot of information out there. Appreciate that.
I know that we don't really hear, we haven't heard about any confirmation hearings during the time of the COVID, but I think we're reaching that point where you've got some confirmation stuff on your table, Senator?
Yeah, there's actually several that have been put on hold during this process, and we're supposed to happen during March. Okay, so the biggest one I think is this: it's a Superior Court judge vacancy, and Dana Gutierrez has been nominated. So her confirmation hearing will be this Wednesday at 1 p.m. So if anyone wants to testify on that hearing, please, you have to contact my office because it's going to be a virtual hearing. And the other confirmations we will be having are to fill vacancies on the Guam Land Use Commission. That would be Dr. Anita Enriquez, the one from UOG, Anita Borja Enriquez. We also have a vacancy on the Guam Ancestral Lands Commission. She's been reappointed. This is Louisa Westling, Ancestral Lands. And we also have one for the reappointment of Dr. Nadine Cepeda. She's a marriage and family therapist representative to the Guam Board of Allied Health Examiners. And we have an appointment for the Guam Historic Preservation Review Board. This is an alternate representative. So this review board, they have regular representatives, and then they have alternates for each position. So Edwin Regis, he works at the Bureau of Planning. He's been nominated for this alternate position.
And is this the guy that's going to replace Dave Lotz, Senator?
Well, that's what the governor announced at her press conference, that he would be replacing Dave Lotz, but Dave Lotz holds a regular position, not an alternate position. So we're going to have a confirmation for him for the position he's been appointed as an alternate. And I have not received a nomination to replace Dave Lotz in the regular position yet.
So are you saying, kind of in a nice way, that someone messed up and nominated and telling Dave that he was going to get booted out of this board?
Well, he might still. I don't know their intentions. So
I thought that was a letter.
He got a letter from the governor.
Yeah, he sent a copy to me. He received a letter from the governor saying he would not be reappointed, but I'm still holding out hope. I'm hoping they're going to reconsider that. He's actually been a very good member of this review board, and he's knowledgeable. He spent years and years, getting up to speed with historic preservation on Guam, with the sites that are at highest risk, which is what I really appreciate about his presence on the board. And he's not afraid to speak out about it, which is, of course, crucial. When I have these confirmation hearings, it's one thing that I practically beg them, we're going to confirm you, and after that, we can't pull you out, right? We don't have that type of authority. And
too bad.
So, we got to take your word for it almost. We can look at your record, but most of them don't have records in these positions. So at least Dave's got a record in this position. We know what he would do. And so I appreciate that very much, that he's willing to be vocal, he's the one who pointed out to us that Magua had been cleared. Yes, and those things, it's not hard. It's not easy to do. So I very much appreciate people who are willing to act on these boards and act independently.
Man, it's kind of a burn deal that they sent him. I don't know how to describe the way the letter was worded, but it definitely wasn't a nice letter. So they sent a letter to Dave saying, hey, we're going to replace you, but they couldn't even get that right. So you're saying that the person they nominated to replace him is actually being nominated for a different position. So where do these
That's
things,
correct, but
where do they come from,
you never
Senator?
know, it might change. Pardon?
Is this something that comes out of, is it like DPR, or is this something from the legal counsel at Adelup, or?
Oh, I'm assuming Adelup, because that's where the nominations come from. Okay. So I don't know. But I think that they might still,
Well, obviously, they don't want him on the board anymore. But Senator, I got to ask, do you think there's a connection? Because everyone is putting two and two together out here, and I think we're coming out with the correct answer, and that how vocal a critic Dave Lotz is. Does that have anything to do, in your mind, with him being replaced?
I hope not. I'm not a mind reader, but I certainly hope not. Of course, I mean, if that is the reason, that is the worst reason. But but I don't know. But
Okay.
I do know what he has done, and that I am very grateful. Very grateful, and he's willing to put in hard work. You know, these board positions are voluntary for the most part. You don't get paid, and so it takes a lot of work to get yourself informed enough to actually be vocal. You have to know what you're talking about.
I'll say. What about health, Senator? Can we just touch base?
Yes.
Health committee chair. What are you working on? What are you looking
A
at?
lot of things going on, of course. You know, we've got past issues that are still with us, as you've talked about all morning. And then we've got the future, right? We're trying to, my goal, we had an oversight here with public health recently, and my goal is, what is it going to look like going forward? And if we are going to rely on the Department of Public Health to ensure that we are all safe while we open these businesses, while we move forward, what's it going to look like? And are we really confident that we can do that safely, right? And I think every state is struggling with this, and you've seen what they've done. And so I asked our own public health, what are we doing? So one thing that I discovered, and so I'll just, you know, they're doing a great job in many areas. I'm going to talk about just the areas that I'm concerned about. And a lot of this has to do with where are we going to prioritize this CARES funding, right? Because the CARES funding is supposed to be what ensures that we can move forward safely. We're supposed to shore up all our systems so that we can do that. So one of the things that we discovered at the hearing is that these opening plans that are submitted to public health's not really approving them. They're just receiving them, reviewing them. Maybe they give suggestions, but they're not exercising any authority, like to say no or to approve. That's one thing that I was surprised about. So you know, we've got industry-wide plans being submitted, and that's, you know, when you submit your plan and the governor's executive order lists you down, then you can open. So that's one thing. So I want them to do more to ensure that these plans are actually good, that they will protect us, right? That they are going to make sure that we are safe. The second thing that we discovered at the hearing was that the Division of Environmental Health, and I know you guys have done stories on this. This is the Division of Public Health that does inspections of facilities, make sure that they comply with the food code, you know, those types of requirements, and they have been challenged for years. They have very few staff, not able to do inspections like we like. Well, with all these new, you know, opening type rules, they told us they are not able to do inspections. I mean, they've got zero additional personnel to do more inspections or even to keep up with the ones that they were supposed to be doing in the past. So that's a huge problem for me. I feel like that's exactly an area where I'm hoping we can, you know, get the administration to shift some funds over there so that we can feel confident that we are doing the right thing by allowing. For example, you just discussed Reventax. When Reventax opens, if it's not safe, who's going to say that, right? I want somebody to be able to get out in the community and say, no, you know, your plan was good, but in reality, this does not look good at all. And in fact, you're putting these Manamco at risk.
So Senator, would that be the Environmental Health Division? Because you're right, and talking about these reopenings in PCOR 2, when we asked the question, well, we reopen all these places, but who's doing the enforcement? Nobody knows.
The people.
That's correct. That's exactly what we discovered as well. So Reventax has authority under their business license authorizations to, you know, I think those who, you know, to go and inspect. And we were told at our hearing that Reventax was concentrating on bars and maybe restaurants, or bars maybe, or I don't remember, bars and restaurants, but certain establishments, while public health then concentrated on restaurants, because they had always been inspecting restaurants, right? So they continued to do that. And so I know they will continue to do that. The problem is the pace, you know, the number of staff. So I'm hoping that we can shore up that division a little bit. We'll see, you know, with either CARES Act money, you know, or prioritize a little bit of the budget, because I just think this is what we need to show the people of Guam, that we are putting in systems of taking care of ourselves. You know what I mean? So we will not reach another, you know, pandemic or outbreak, right? That we can lock those things down right away. The other one, of course, at the hearing we talked about was the tracing. This is, everybody across the nation agrees, if you can't trace, then you shouldn't open, because you're asking for trouble. So you need to be able to trace quickly. And so what I'm urging public health, they told us all their plans to increase tracing. They actually are getting, new software or systems to help do this. So they're working on it. But the issue for me is, I think the public still needs to know more information. And I know you've had Dr. Lombard on your show, but the questions that he asked, that he wants public health to answer, for me they're excellent questions, because there's questions such as, what failed? How did this person get the virus? Was it because they weren't using masks, because they went to a certain place, because this place, was not being cleaned? What is it? So when we can get those answers, we can empower our community. And our community, we've seen, is excellent if they get the right information. So I want them to know that information. So I'm trying to push public health that's the information we want to know. 2 positive cases, it almost doesn't mean much to us if we can't figure out, how did that happen? What are we doing wrong? And we need to know quick. I told them real time. We want real time, right? That's the only way. Otherwise, my goodness, I do not want to see, GMH be overwhelmed again. I hope that's not our plan. So I'm trying to push it. That's supposed to be the plan for every state, that you're supposed to make sure you're able to trace quick and stop it in its tracks. And that's the goal. So that was another issue. I think they need to get out more information. They need to give us more of the details. I think it's very clear they can do that without violating HIPAA. So I'm asking them to work on that more. And I know that you guys have also been asking that.
Yeah.
Right. Senator, I had a couple questions as it relates to the Department of Public Health and also the governor's superpowers. So she's able to, she has this tier 3 tier clinics, you know what I'm talking about, FHP.
The cure setup that they had, yes.
Yeah, and so you have these tier 2 clinics, and there's no agreement, no MOU. I know that Speaker Barnes had been trying to get to the bottom of that, but there's no agreement in place. There's CARES Act funding according to this budget breakdown by the government that allocates X amount of $7 million, I think it is, or $6 million. But then you also have this contract with a company that's unsigned, HSP. Public Health didn't sign it. And I'm just wondering, why would we need a contract? Well, we have a contract with HSP to provide all these different services, but yet we don't have anything in place for these 3 clinics. Is that something that, that's on your radar, or just kind of doesn't seem to jive? Since
the beginning. So when they first announced their, as you know, we're only seeing contracts now that you guys have sent in FOIAs, and but we've asked for them. When they first announced their cure setup, I've asked, well, how does that actually work? When you say these people are in your tier 2, do you have a contract? So I was told, no, there's no contract. So it's never really been clear to me what the setup is. But of course, the doctors they're all on the advisory group. So but I'll tell you, I've received several calls, maybe in the last couple weeks, 3 weeks, that, now that they were more concerned about, what really the agreement was. And the bottom line is, if it, I'm assuming I told these clinics, they're going to have to take it up with the governor. It's between them. They made an agreement, or whatever they did, that's between them and the governor. But when it starts to impact our health care, then I think that's a very serious issue for the entire community, right? That, for example, one of the clinics telling me that their business, was kind of diverted, and they became a COVID, testing place, COVID treatment place, and then the other patients were not coming in, and so that has actually affected their business so much that they might be having to let go of healthcare personnel, right? At a time when Guam is in dire need of healthcare personnel. So those are the serious implications of getting to the bottom of that. And I definitely agree. We need to get to the bottom. I don't want to interfere with their contracting or anything like that, but I do think it has had serious repercussions, and we just need to make sure. One of the things we're supposed to come out of this with all this, federal funding is we're supposed to shore up our healthcare system. So I do not want to end up in a situation where we have less doctors than we started off with, less nurses than we started off with, or nurses who are quitting on us because they didn't like how they were treated during the emergency, right?
Wow, yeah.
So
it's a reality.
That's the reality, and we need to take care of that. I think that's serious, and so when I look at the funding, if you look at public health, what they're getting out of this CARES, they're only actually getting money that they've already spent, and nothing, it looks like to me, according to this plan from BBMR, going forward. So that's what I've asked them to redo. Like, BBMR says they haven't submitted anything going forward, and I'm like, what is up with that? They have to. You are who we are relying on. So you've got to, step up and submit a plan going forward. We're also looking at huge amounts, or a large amount of people who are not covered by health insurance anymore due to unemployment, right? So they might get unemployment pay, but we need to take care of the health side, right? Otherwise, end result, they go to GMH, they're not going to be able to pay. And so we need to either cover it up front with, coverage under Medicare, MIP, or Medicaid, or MIP, or we, or we're just going to pay it all out at GMH, and then people are going to ask us, why are we subsidizing GMH? That's why, because we have now a large part of our population without any coverage at all. And I think that's very serious, because of course when you're not covered with insurance, then you don't go to the clinics for early care, right? And they're coming in with more dire care. So that's the big picture. I saw we had a oversight with the Department of the Office of Technology, right? Yeah. And even that, so I'm looking at this CARES funding. They received no CARES funding according to this BBMR plan, and
they couldn't get some iPads or some laptops, or
what I'm looking at them for is like when we have this whole public welfare, you can apply for SNAP, you can apply for Medicaid, MIP, all of that. It's not an online system, right? You can download your forms, but then you got to go drop the box. It was not user friendly, I think, as much as it could be. And I think we've got to get this internet capability out to our communities. We've been talking about this for years. Years we've talked about it, putting them in the mayor's office, the schools, so that they, again, could be accessible to the community all around them. Our schools are built right next to the villages. So that kind of thing, it was very troubling for me to find out OTEC receives no money to coordinate this type of putting all these agencies online. We're doing it through the agencies, and so it's pretty much what each agency asks for. And so I just want a big picture, coordinated response, and one that's fast. So one of the things I think I put in one of the budget bills was that we're going to have an online central website, so that all of this is for transparency, right? All of our government meeting notices are going to be on one website. You don't have to go all over to every agency's website to find out whether they're having a meeting, and all of the meetings would be on there for everyone to see and know and be informed and participate. It's taken, I think, over 2 years to get a central website up. And so they've told me there are very many challenges and that they're very close to getting this up. But I'm just really hoping that, our response going forward with this federal funds has to be quicker. We have to get our people capable of, getting on the internet. I think it's going to help them with job loss. They can, look for jobs. They can train themselves. And it's going to help our students, and we know that these impacts will go for a very long time.
Just talking about the accessibility, I was talking with a teacher over the weekend, and they were saying that about less than 30% of their students are turning in this distance learning stuff because they just don't have internet, and so there's obviously connectivity issues. And
Right.
I don't know what if that's what kind of thing you're talking about, is providing the
That's
access.
exactly what I'm talking about. I'm
Right.
talking about the students. We know they were not able, many of them no access. Not only DOE students, but UOG students. And I think that tells us what our entire, system looks like. And I just don't find that there is any reason why our villages cannot be connected, and I think everybody says they're working on it, and I think they need to get that done. We've got millions of dollars going to DOE, right, for upgrading their capacity to do this. We've got 12 million at least going to the governor's office specifically for educational purposes. Right. And then we've got money, going, we were supposed to have these programs through, the mayor's offices. We were supposed to be able to set up, right, connectivity. The libraries, they're talking about setting it up through the libraries with MiFi. That's what OTEC talked about. But I remember years ago talking with UOG, they were going to be the hub for the Pacific, for an education hub for an actual cable. And it was a huge deal. And I said, well, I hope that this cable, that you being the hub, will allow us to get this out to DOE and the community from DOE, even if we have to use parking lots at first. But this day and age, our communities are small. We should be able to do this. We should be the shining example of doing this. And I'm hoping I want to lift these people up to, if they need something from the government, they can get it immediately. Most of the calls I get through my office is they need assistance with public agencies, right? They need something from CLTC, and CLTC was not responding. They needed something from, public health, and they just couldn't get through, I know you guys have talked about these issues too, and you do the same, that type of work also. So it's just connecting to the public agencies should be the easiest thing that we empower our people to do.
All right.
Get answers right away.
No, I just wanted to ask about this contract for Polaris Court, and if you had any concerns with that. I think Lillian Posadas was on the air last week regarding it. This Polaris Court was for staff, right? Nurses, maybe. But I mean, it was 17 fully furnished condos. I'm not familiar, and I haven't looked at the contract itself, but I'll tell you what I know on that is that since before they even opened the SNU, they told me they had a plan for those nurses and doctors and healthcare staff who would be exposed to COVID at the SNU, that they would have a place to stay, right? That they were going to be offered that, so that they did not have to go back to their family. I thought, wow, that's great advanced thinking, right? Where we were on it. I never ever could get any of the details on it, and then I know we had quite a time trying to find out why the nurses at GMH, emergency room, ICU, were not being extended that offer as well. And then, so, if it's finally determined that, okay, we've extended the offer to all of those people. So, I don't know, the timing. I'm telling you, we are going through a lot of what the media is going through. When we ask for information, we get bits and pieces, and it's hard to get the big picture, which is very frustrating. Yeah. And it makes us want to,
flip your desk,
say negative things. But we need to move forward, and I'm trying to move forward. And there's so many things I could go back and talk about, but I just want to move forward. But man, I want to move forward smart. I want to do this in the smartest way we can. I want Guam to shine. I want to show that we know what we are doing here. We know how to take care of our people. Yeah. And I think that's got to be our focus. Opening business for just the sake of opening business is not as important to me as we're going to open it because we're going to take care of people, because they need these businesses, and because we've proven that we can do it safely, right? And that we are going to do it safely. And if they're not going to comply with the safety measures, then we will not allow it, because I want our Manamco to get a life back, right? I don't want them to be on forever lockdown, and that's going to really take our entire community to make them safe. And I just think if we think of that as the goal, I think that's been our goal all this time, and that's why, stay at home has been successful.
Stay home!
Yeah, because we love our manamko, and we don't want to harm them. And
Yeah.
so I just think we should do the same, opening up the businesses, Is this going to keep our manamko safe? And we build up our agencies the same way. You just, everything we do has to be geared towards getting caretakers to be able to work from home, stay at home, getting, students to be able to learn from home if that's the new norm.
Senator, I wanted to interrupt here, but you were successful in the override of Bill 333. Has there been any discussion on the override of Bill 326?
That is the pay?
Yes.
Yeah.
Okay. I think I don't want to speak for her, but I'm pretty sure Senator the Vice Speaker is working on a different bill.
I see. Okay.
I don't know,
Okay.
but I know that I'm going to say too that has been nothing but frustration. This whole discussion on pay, and that's one of the things I just had a discussion with Public Health a couple of days ago. I wanted them to tell me, have all your nurses been given the differential time at least, right? Have they all been given this? Because I've been receiving calls. So they swore that at the time that we talked, they had all been given their differential time, and that they had come up with this overtime plan. They were all going to get their overtime. So so I was hoping that the nurses at Public Health and all the staff at Public Health, they would at least get their overtime and their differential pay that they're entitled to. Now, the double pay issue is really the most frustrating one, because that's exactly why we were in session longer than we expected during that time. If you remember, we could not get anything definitive from anyone, I think, at the time, as to, what about the double pay? Why is this? What is the effect of this on the double pay? And I know the AG said that no one had received double pay, but that's not what we are told. Right? We are told that there are employees. They tell us, "Oh no, I always receive double pay," or whatever.
Right,
so
yeah.
That's something new. I'll say that. If that information, I would like to get clarification on, and we know that GPA was getting double pay. We know that for sure. And so even if you look across the agencies, it's not going to look fair. And it's never going to look fair, right? And so,
and I think Senator, we had spoke with the husband of a nurse earlier in the show, and he had said that, what's frustrating for these frontliners, a lot of them have received the double pay.
That's right.
In prior emergencies.
This morning, I heard him. He said his wife had received double pay after typhoons.
So when we talk about the differential pay or the overtime, I mean, if I'm an essential worker going into this, and I know that I'm going to shield up and I'm going to go out there because the COVID, but it's okay because I'm out here risking it and I'm getting the double pay. And then later on to find out, no double pay, it's a 25%, it's a 10%. I mean, it's really an insult to trying to push this. And
right. This is the thing. Communication really would have served us much better back then. Week one, when, we were told some employees were going to stay home and still get paid. We were told some employees were going to work from home. And then we were told some employees would have to show up and do some stuff, right? And we, of course, know the frontliners. They weren't even discussed. They were just assumed they were going to show up and do their stuff. But I remember calling DOA and asking him, what is the plan for this? And I always try to call and make sure, if I can just be assured they're working on it, then I'm, I don't have to harass anyone. But
no, please harass people.
I was assured they were working on it and they had a plan. But the issue was that took a long time to actually get, into an executive order, into something that we could actually deal with, and then be told at that point that it doesn't go retro, and then be told, after that it conflicts with potential double pay, and then be told now that the Attorney General all along, kind of, I don't know, it's troubling for me, because I thought one of the things I heard during press conferences was we're working with the Attorney General.
Right.
And
I hear that a lot.
I always figured that they're going to figure out all that kind of technical stuff, which is really the difficult thing to do, and it's just silly to me. If we're in an emergency, sorry, maybe that's not the right word, but if we're in an emergency and we're not going to consult our lawyers, right, on the top, of course we're looking for trouble. I mean, we're going to get into a mess. So I just feel like you've seen it with this. Now we're going to redo our procurement of quarantine hotels.
Oh, Lord.
It makes no sense.
No.
Now we're going to redo our whole fee structure. Weeks or months later.
Senator, we used to play.
We need a solution, and we need to move forward. And I don't know. We have laws in place so that these things are decided in advance, not after the fact. So that's what's very frustrating.
It's so frustrating. It reminds me, we used to play kickball when I was young, and we'd kick it, and if it didn't go the way you wanted it to go, you'd be like, "No, do over DC, don't count."
Mulligan. Is that in golf?
Yeah.
Well, I'm actually, I'm all for fixing it. Let's fix it, whatever. But yeah, we just,
let's also try and make sure we do it right the first time too, right, Sarah?
Absolutely, let's do it right the first time. This is a lot of things too. And if we're talking about policy, then that's where transparency, discussion really helps, because you can tell me, we put this into motion, but if you tell me why and why you didn't do it any other way, then we're not going to waste any time going down those roads. If it's very clear, right, that there's a reason we can't go down that road. And that's what really has not been clear with this, the double pay. I worry now. Now we're getting into money issues, right? I think this is an after the fact thing. Now we're into money issues, whether we get reimbursed by FEMA money or we have to use the CARES Act money. And if we use the CARES Act money for, one thing, then we absolutely do not have CARES Act money to get this environmental health division at public health up to speed, right?
Yes.
That's my problem. It's like whatever we're going to take out of CARES Act, it should be easy and the governor gets full discretion. But, that's our funding to move forward for Guam to keep us all safe.
Correct.
So I would, if we have another avenue to fund,
FEMA.
pay through FEMA,
like FEMA,
then
right?
it sounds great to me, right?
That
sounds like a way to go. So we'll see. Yeah.
We gotta run. We're at the top of the hour, but I wanted to share a comment with you before you go.
Sí.
Por favor, Senator Therese Terlaje, Hungan, harass all of them.
See, you know what? To be honest, you guys, I don't like to harass people, but they think I am harassing them when I ask questions, which really bothers me.
Yeah.
Because
I hear you.
A question, and that's
Welcome to our
really
world.
all we need is we just need the answers, and we need them fast, without attitude, please. And that's what I would like. And that's
Leave the attitude at Adeloop, okay?
That's how we get
Leave
to
the attitude at
solution.
Adeloop.
If we need to get to the solutions fast.
Thank you, Senator.
Thank you.
Oh, my
Esta,
God.
okay. Wash your hands.
Take care. I like that. Leave
Without
the
attitude. You're giving me attitude? You're giving me attitude.
Hmm.
They are. They're giving a lot of attitude. Okay.